Good afternoon, and thank you for the opportunity to present this audit. My name is Zachary Mukhaizeem. I'm an anaesthesia SHO at the Coombe Hospital in Dublin, and this is our audit of preoperative anaesthetic assessment referrals for elective obstetrics and gynaecology patients. Structured preoperative assessment is well established as a cornerstone of safe elective surgical care linked to fewer postoperative complications and unplanned readmissions. Recent study found that shifting preoperative assessment to at least 24 hours before surgery nearly halved avoidable postponements and cut wasted bed days. The Royal College of Anaesthetists 2025 guidelines for the provision of anaesthesia services state that all patients should be assessed prior to anaesthesia. In other words, the implied national standard here is 100% referral. Our audit set out to answer a simple question: were elective and obstetrics gynaecology patients at the Coombe actually being referred against that standard? We carried out a retrospective case note review of every patient listed for an elective obstetrics and gynaecology procedure in March 2026. 276 patients in total, 171 gynaecology and 105 obstetrics, with emergency cases excluded. For each patient, we recorded not just whether they'd been referred, but how. Directly from the surgical team as part of routine listing, or picked up and self-referred by the anaesthesia team. Our primary outcome remained the overall proportion of patients referred by either route to the pre-op anaesthesia clinic. Overall, the referral rate for March 2026 was 87%, 240 of 276 patients. Of the 13% who weren't referred, 3.6% had never been seen in the preoperative outpatient setting at all. The larger group, 9.4%, had actually attended the preoperative clinic, but simply hadn't been formally referred by the surgical team. Compared with previous cycles, this is a real improvement. Our baseline in July 2023 was 91%, which declined to 78% by March 2024, partially recovered to 84% in September of 2024, but then unfortunately drifted down again to 82% in March 2025, and finally 81% in August of 2025. This latest cycle, at 87%, is our highest referral rate since that original 2023 baseline. Overall, referral rates have recovered well this cycle, reversing 2 years of decline. However, we're still short of the 100% standard the RCOA guidance applies. Most of the shortfall comes from patients already seen in clinic, but not formally referred. A documentation issue, not a capacity one, which makes it a realistic target to close. We'll keep re-auditing this regularly to make sure this improvement holds and preoperative assessment stays embedded in routine elective care at the Coombe. Thank you.